Good morning, sir. Welcome to the pharmacy. How can I help you today?
Good morning. My name is David. I have a new prescription here from my doctor. I'd like to get this medicine, please.
Of course, David. Let me just take a look at that for you. Okay, I see. I can prepare this for you right away. It will just take a few minutes.
Thank you. Actually, while you prepare it, I was wondering if I could ask you a few questions. This is a new medicine for me, and I'm a little nervous.
Please, ask me anything you like. That's what I am here for. It is very smart to ask questions and be informed about your medication.
I appreciate that. My main concern is about the side effects. The doctor mentioned a few things, but it was all very quick.
I completely understand. Discussing side effects is one of the most important parts of starting a new treatment. I can definitely go over that information with you in more detail.
That would be wonderful. I want to know what to expect and what I should look out for.
It's my pleasure to explain everything. Let me just get your medicine from the shelf, and then we can talk through it all, step by step.
That sounds perfect. Thank you for your time.
Okay, David, I have your medicine right here. Before we talk about the side effects, let's first quickly confirm the purpose of this medication. Do you know what it is for?
My doctor said I have a bacterial infection, so this medicine is to fight that infection.
That is exactly right. This is an antibiotic. Its job is to stop the bacteria from growing and to help your body's immune system fight off the infection.
Okay, so it's a standard antibiotic. I think I have taken something similar before.
It is a very common and effective one. It is important that you take the full course of the treatment, even if you start to feel better after a few days.
What do you mean by the full course?
The prescription says you should take 1 tablet twice a day for 7 days. You must finish all the tablets in the box to make sure the infection is completely gone.
Okay, twice a day for 7 days. I will make sure to finish the whole box. Thank you for clarifying that.
You're welcome. Understanding how the medicine works and how to take it correctly is the first step. Now, we can move on to your question about side effects. When we talk about side effects, it is important to remember that every medicine can potentially have them. However, most people have no side effects or only very mild ones.
So it is not a guarantee that I will feel sick from this?
Not at all. Many people take this antibiotic without any problems. I am just giving you the information so you are prepared, just in case.
I understand. So, what are the most common side effects for this particular medicine?
The most frequently reported side effects are related to the stomach. Some people might experience a little bit of nausea or an upset stomach.
Nausea. You mean a feeling like I might be sick?
Yes, exactly that. Or you might just feel a little bit of discomfort in your stomach. Some people also report having a change in their appetite.
An upset stomach and nausea. Okay. Are these effects usually very strong?
No, typically they are very mild. They are most likely to happen in the first day or two of the treatment as your body gets used to the new medicine.
That's good to know. So it's a common and usually mild problem. You mentioned that an upset stomach is a common side effect. What should I do if I start to feel that way?
That is a very practical question. There is a simple way to manage this and reduce the chance of it happening at all.
Please tell me. I would prefer to avoid feeling sick if I can.
I recommend that you take this medicine with food. Do not take it on an empty stomach.
So I should take it right after I have a meal? Like after breakfast and after dinner?
Yes, that is the perfect time. Taking the tablet with food or even with a glass of milk can help protect your stomach and prevent that feeling of nausea.
That's a great tip. So take it with food. I will be sure to do that.
The label I have put on the box also has this instruction written on it, just as a reminder.
Oh, thank you. That's very helpful. It's good to have it written down.
We try to make the instructions as clear as possible. So, for any mild stomach discomfort, taking the medicine with food is the best solution. Now, let's talk about some of the less common side effects. These happen to a smaller number of people, but it is still good to be aware of them.
Okay, so these are things that probably won't happen, but are still possible?
Exactly. Some people report experiencing a mild headache when they first start taking this antibiotic.
A headache? Is it usually a bad one?
No, it is typically a mild, dull headache. Like the headache, some people might also feel a little bit of dizziness.
Dizziness? Like the room is spinning a little?
Yes, a feeling of being a little lightheaded or unsteady. Again, this is not very common, and if it does happen, it is usually mild. And do these side effects, the headache and the dizziness, last for the whole 7 days? In most cases, no. These types of side effects often go away after the first couple of days. It is just your body adjusting to the medication.
So it's a temporary reaction. That is reassuring to know. I am a little concerned about the dizziness you mentioned. I have to drive to work every day.
That is a very important point to consider. Your safety is the top priority.
Would it be dangerous for me to drive if I feel dizzy?
Yes, it would be. We advise that you do not drive or operate any heavy machinery if you are feeling dizzy or unwell.
So what should I do? I have to take the medicine, but I also have to go to work.
I would suggest being very cautious, especially after your first dose. See how the medicine affects you personally.
What do you mean by that?
Your first dose will be this evening after dinner. You will be at home, so you will be in a safe environment. You can see if you feel any dizziness then.
That makes sense. So I can test how I react to the medicine when I am not planning to go anywhere.
Exactly. If you feel fine this evening and tomorrow morning, then you are probably safe to drive. If you do feel dizzy, you might need to arrange alternative transport for a day or two. And always be extra careful when standing up quickly.
Thank you. That is very practical advice. I feel much better about it now.
Okay, David. We have discussed the common and less common side effects. The last category to discuss is very important. These are the rare but serious side effects.
Serious side effects? That sounds scary. You said they are rare?
They are very rare, but it is my professional duty to make sure you know the warning signs, so you know when to seek immediate medical attention.
I understand. It is better to have the information. What kind of signs should I look for?
The most important thing to watch for are the signs of a severe allergic reaction. This can happen with any medication.
An allergic reaction? What would that look like?
The most common sign is a skin rash. If you develop a red, itchy rash on your skin after taking the medicine, that is a warning sign.
A skin rash. Okay. Are there any other signs?
Yes, other signs can include swelling, particularly of your face, your lips, or your tongue. And the most serious sign is any difficulty breathing or tightness in your chest.
So, a rash, swelling, or trouble breathing. Those sound very serious.
You've told me the signs of a serious allergic reaction. What should I do if I experience any of those symptoms? A rash or swelling, for example.
This is the most important part of our conversation, so please listen carefully. If you experience any of those signs, you must stop taking the medicine immediately.
Stop taking it completely? Even if I haven't finished the 7-day course?
Yes, in the rare case of an allergic reaction, you must not take another dose. The first step is to stop the medication.
Okay, that is very clear. Stop taking the medicine. What is the second step?
The second step is to seek medical help right away. You should call your doctor's office immediately and tell them about your symptoms.
And what if it is in the evening and my doctor's office is closed? Or if I am having difficulty breathing?
If the symptoms are severe, especially any swelling around the throat or difficulty breathing, you should go to the nearest hospital emergency room or call for an ambulance.
So, it's a medical emergency.
A severe allergic reaction is a medical emergency, yes. Again, this is extremely rare, but being prepared is key. Do you have any questions about that action plan?
No, that is a very clear plan. Stop the medicine and call a doctor or go to the hospital. I will remember that.
I know this has been a lot of information to take in all at once.
It has been a lot, but it has all been very clear and very helpful. I am glad I asked.
To help you remember everything, all of the information we have discussed is also available for you to read.
Oh, really? Where can I find it?
Inside the box with your medicine, there is a folded piece of paper. This is called the patient information leaflet.
I think I have seen those before. I usually don't read them because they have very small print.
I understand that, but I strongly encourage you to take a few minutes to read this one. It contains a complete summary of everything a patient needs to know.
So it will have the information about how to take the medicine and all the side effects?
Yes, it will have a specific section, usually number 4, that lists all the potential side effects, from the very common ones to the very rare ones. It explains everything we have talked about today.
That is great. It means I don't have to worry about forgetting anything. I can just check the leaflet if I have a question.
Exactly. It's your personal reference guide to your medication. Please keep it with the medicine box.
Thank you so much, Emma. I feel so much better now. I came in feeling nervous, but now I feel informed and prepared.
I am so happy to hear that, David. That is always my goal. An informed patient is an empowered patient.
Let me just quickly summarize the key points in my mind. Take the medicine with food.
Yes, that's the first key point.
I should watch for mild side effects like a headache, but they will probably go away. And I should be careful about driving if I feel dizzy.
Perfect. You've understood that correctly.
And finally, I know the very rare but serious signs of an allergic reaction, and I know exactly what to do. Stop the medicine and call a doctor.
You have summarized it perfectly. You have all the important information. Please remember that this medicine is considered very safe and is very effective for treating your infection. The chances of having a serious problem are very, very low.
That reassurance helps a lot. Your clear explanations have been wonderful.
It was my pleasure. Do you have any other questions for me today?
No, that's everything. Thank you for your time and your patience.
You are very welcome. I hope you feel much better very soon. Please don't hesitate to call if any other questions come to mind.